Welcome back, and thanks for staying with us here for the COVID-19 Vaccine Town Hall.
And as we discuss the need for a vaccine, we wanted to hear from those who have been fighting this virus on the front lines.
Right now, let's welcome our panel of health workers, health experts. We are joined by Nurse Monica Hammerly from IU Health, Dr. Hariam Joshi from Parkview Health in Fort Wayne, Courtney Creets, who is a street medic with IEMS, and Jennifer Cattell with Beacon Health Systems in South Bend. We want to say thank you to all of you for joining us and welcome. At the beginning of this pandemic, many people felt COVID-19 was a virus much like the flu. Dr. Joshi, I want to go with you first. Do you recall the moment when you yourself realized COVID-19 is much more serious than just a seasonal flu? Dr. Joshi, can you hear us? Okay, we are having some technical difficulties with his connection, so we will get back to him in just a few moments. Birchelle, I'm going to send it over to you.
Yeah, in the meantime, we want to talk to Monica. She's a nurse, and throughout this course of the pandemic, we know that nurses like yourself and other healthcare workers were not only patients' advocates and taking care of them, but also sometimes their final goodbyes. So how did you handle that responsibility?
Hi, can you hear me? I am not
Yes.
sure that I am.
We can.
Can you hear me?
Yes, we can.
Oh, good. I'm sorry. You asked me how do I...
Just
I'm
how did
sorry,
you handle that responsibility? We know so often that nurses like yourself have had to really take on that responsibility of saying the final goodbyes with people, holding their hands and being there when their family members or loved ones couldn't. So for you, how did you manage that?
Well, we have found tremendous support within each other of our team members. It has been extremely difficult to not only be the nurse, but also be the person that is staying with the patient as we wait for them to pass. It has been extremely emotional for all of us. It has taken a tremendous toll on all of us. And I have to say that my faith has kept me going, my family, and my teammates.
And to have to experience that every day, how has that been like? Because you're not just doing this, you know, every now and again. This has been a continual thing for almost a year now.
Yeah. Again, it has to be a wonderful thing to have the support from our teams. Nobody knows exactly what we go through except another nurse. I am very, very fortunate to have family members that are nurses who have been dealing with this. So to share our feelings and what we have been experiencing, it has been a tremendous comfort. I just can't imagine doing this without the support of my family and our teams. The other nurses have been able to share with each other and support each other, calling each other, listening to each and every one of their stories has been tremendously helpful. And we just hope that soon this will stop and that soon we'll be able to share other stories and stories of hope, stories that, you know, with nursing, we do have our deal with death, but nothing has ever prepared us for what we have experienced in the last few months.
Wow. And it sounds like that shoulder to kind of lean on has been so great for you all to have that support. But for your family members of these victims who passed away, how has it been for them when you make the call, and what have they said of you being in the room with them? And I'll give that to Monica as well.
Wow, that is to be able to participate in that level with the loved ones of your patient is something that is, I personally take it as a tremendous honor. To be able to show the emotional rawness that we feel is tremendous. It's a tremendous honor for all of us. We shed our tears. We share them with them. This is somebody's brother, is somebody's daughter, somebody's parents, and all of us can put ourselves in their place. It is very easily done. We share their loss, but we also, when things do turn out okay, we also cheer them, and we have had those experiences also, and that is amazing. It is the most wonderful feeling, and that's why we became nurses.
And we can't thank you all enough for what you do. And I know that many of you seem like you were kind of nodding in agreement as Monica was talking about her experiences. Jennifer, we know that so many people who are working in hospitals have gone through what she's just described. What has it been like working in these COVID wings for you, where you are seeing patient after patient die?
I know for me, myself, I support the HR side of our business, and, to make sure that our frontline healthcare workers are supported and that they have everything that they could possibly need, that is of our utmost importance, and make sure that they are getting respite care and making sure that they're getting taken care of, because they are that line of support for those patients that we have. And so I've really, enjoyed being able to answer, their calls of help and that they need at that time.
There's been so much emotion connected to the fight of this pandemic. At the beginning of this pandemic, a lot of people felt that the COVID-19 virus was much like the flu. Well, boy, do we know differently now. And we have lost so many of our loved ones, and there's been so much hurt, so much pain, and so much fear. Dr. Joshi, I want to go back to you with this question. Do you remember the moment when you yourself realized that COVID-19 is much more serious than just the seasonal flu?
So this is beginning in the March when we started having this situation that we are having cases in the United States, and basically we rely on the data from the China at that point of time, and we realized that the data does not suggest that this is like a flu. If I look back, I wish this was just like a flu. It would have been much easier on all of us. But that was a time when we thought that this is much more than a flu, and the thing is, this was pretty much new thing at that time, so nobody knew how it spread, how deadly it's going to be, how easily it's going to spread.
It's been interesting to hear so many people talk about the realization of that, and we talk about so many people who have leaned on faith, they've leaned on each other, they've leaned on coworkers, they've leaned on prayer. What has gotten you through in terms of treating as a physician, having to go between, I'm sure, very difficult moments, but also needing to be there medically for the people you're caring for? Where are you drawing your strength from?
So my biggest strength is my work family as well as my home family. Like I have my nurses, my RTs, my EVS people, pharmacists. They are my backbone, my strength when I'm at work. And when I go home, I basically just spend time with my family, my kid, and just try to relax. Ultimately, at the end of the day, I tell myself that I came to this profession to help the people. We, being intensivists, are very hardwired to take care of face the death, but this is much more than what we have been trained for.
I want to jump in here just really quickly. And Fanchon, you know my story about my mother, and I think you do too, Berchelle. My mother was diagnosed with COVID in November, and we thought she was going to pass away. She survived with a lot of prayer and a lot of great nursing care and doctors who attended her. She's 91 years old. So I want to thank all the nurses out there and the doctors who have done such work. You can see the stress in their lives. You can see how this has taken a toll. So I just want to say there is hope, and my mom has survived. She's 91, which is amazing. So I just had to say that and to say thanks. Courtney Creets, we're going to turn to you for a quick second here. You are a street medic with IEMS. Did you or your colleagues ever have to ration PPE? Did you have to go through that? Did you have to face any equipment shortages, especially in the beginning of all this?
We were actually really lucky. Our organization has really good at back stocking things for us. So we were actually able to share PPE with other organizations that were short or that had shortages. So we were actually very fortunate. We were one of the few, I from what I can remember, we're very fortunate that we always had enough PPE, and we were really lucky and able to help others out as well.
Thank goodness, because it was touch and go there for a while. As you probably know, the city of Los Angeles was recently forced to ration their care, going as far, they say, as to telling medics to not transport patients who have very little chance of survival. Did we ever get close to that point here in Indianapolis? And if not, how did we manage those resources during our peak? We'll go back to you.
No, we never really got close. We never got close to that here. We have always made it a point to know, like, if you need help, call us. We'll be there for you. We'll be there to take you to the hospital. And, there's always been hospitals that have been open. Luckily, I know they've been hit very hard here. We've been hit hard as well, or they've been hit hard there. We've been hit hard here as well. But we've been pretty fortunate that we have been able to, always answer the call for people, and same with the hospitals in the area.
All right, thank you for that. So many times, so many of us, it's hard to leave work at work when we're finished with our shifts. We talked about, and Debbie, so many of us here at work were praying for your mom while she was sick, and it's a victory that she came through that at over 90 years old. And Dr. Joshi, I want to talk with you just a little bit about hope. We've talked so much about the seriousness of the disease, the emotional toll that it's taking, but there are so many people that are still recovering from this disease. Does that give you hope in terms of being a frontline worker? Someone mentioned it a little while ago in terms of seeing people recover, overcome, and get back to life. I know some people, it's a difficult road, but there are more and more people recovering. So overall, is that giving us hope as we go forward through this pandemic?
Yes, definitely. There's always a hope that whenever we see a patient in the ICU, we always hope that they make through it. And as we are knowing more and more science, new and new method of treatment, our hope is that we get much and much better in terms of taking care of this patient. But still, these are one of the sickest patients I have seen in my life.
Well, that is encouraging news. I know Johns Hopkins had a statistic out in August saying the recovery rate from COVID-19 is something like 97% to 99%. So that is important to remember those numbers as we do continue to fight this and move through it. A lot of people recovering. Dr. Box and other top health officials continue to highlight the work of our health workers. We are so grateful. She says it continues to be a marathon since March. Nurse Hammerly, how do you keep yourself and your coworkers motivated, especially on the toughest days?
We have to be positive. We have to be positive. We want to see our patients succeed, and we try to put our smiles and we try to be supportive to each other. I need to do a shout out to our RTs, if you would allow me, please. Our respiratory therapists have been amazing, and we just pull each other up. To begin with, I belong to an amazing team of people, and we are all one for each other. We are there to support each other. So being positive and trying to help each other. We have this philosophy, we can do just about anything for 12 hours. We have to do this. So it's a mind thing. We have got to absolutely pull through for each other, for our patients, and for each other.
And I love to just hear our nurse here, Monica, speak, because I think she's such a reflection of what we see in our healthcare industry. All the 4 people that you see here have worked for a year to take care of the sickest people in our nation. And what you're hearing is selflessness. And it goes without saying here, this pandemic isn't like anything we've seen in our lifetime. So I'm going to come back to Monica. What lessons have you maybe learned that could prepare us if we ever face another global pandemic like this again?
I know it may be a little cliche, but I truly believe that unity is what will keep us going. Knowing that I have somebody's back, it's what's going to keep us going. We're going to succeed. So is a matter of taking those little lessons that we have learned through these months. We can pull through a lot, and being a force of positivity, and I just feel that it is something that will not only help us today, but tomorrow. If things continue to improve, we're going to have some stories to tell tomorrow. And I'm looking forward to this to be a thing of the past. I want to be able to say, remember when we used to do this? Do you remember what we went through when we had that horrible ordeal with COVID? I want that to be a thing of the past. And I can assure you, all of us that are in the medical field have the same feel. We want this.
And I'm sure people who are watching right now are shaking their heads in agreement and wanting the same thing, just for us to put it behind us. But in order to do that, we do have to reflect and see where we are. So let me ask Courtney, what lessons did you learn?
As Monica said, you know, coming together, I think that through this whole thing, we've learned that, you know, you do have to come together. This has obviously been a very hard year for everybody, but I think what it's shown everybody is that, you know, when everyone comes together, we can really manage great things. Even with all the bad this year, there's been a ton of good with the community helping out, everyone at like coworkers, families, everybody helping each other out so we can all get through this. We're all going through the same thing here.
So it sounds like unity and a lot of perseverance is what we've seen here. Let me ask Dr. Joshi before we move on to our next topic. What is something maybe that you've taken away from this pandemic and could help you in the future as a physician?
It just, we have been taught to be a team player, but this has just taken it to a different level. Now, at least even if we get any other situation like this in the future, we know we got us.
Circle back, if we can, here and return to a question that we didn't quite get answered, a little tape problem there. Earlier on the program, we touched on vaccine skepticism, even among healthcare workers. By show of hands, did any of you have any reservations about vaccine development? We've got all four of you on the screen right here. Can you raise your hand if you were concerned? Any of you concerned? I'm not saying everybody's shaking their head, no concerns about this. So sounds like you've probably all had your vaccinations and you're good to go. Is that right? There's your card. All right. Well, Ms. Kreis, we got a question for as a frontline health worker. What message I want you to share, if you would, with our viewers about the COVID-19 vaccine? You said you've gotten it.
Yes, I have gotten the vaccine, and I've actually had the privilege of vaccinating people through Eskenazi. We are doing a vaccine clinic there, so I've actually had the privilege to vaccinate other healthcare workers and the public as well, the 70 and older public now. And it's been great because everyone's so excited. So I would just say, trust the science. Vaccines work. We all know vaccines work. We've been using them for years.
Exactly.
So yeah, I would just say, trust it, and it's been a great thing. We're giving us a lot of hope.
Can we ask one of the nurses on the panel as well? Have you had to reassure any of your patients who've come in and said they were a little bit frightened about it? What have you said to patients who might be a little bit scared?
Absolutely. I will always encourage to ask questions to their physicians. If you have any type of concerns, do not go by what you hear here and there, and you get to a physician, get to your primary care physician and ask questions. Vaccines work. Vaccines have worked for a long time, and it is a must. We have to be vaccinated. We have got to have this under control, and vaccines are the way to do so.
I'm going to ask one more member of the panel. Any other times you've had to reassure a patient or client to get this vaccine, and what have you said to them? Doctor?
Just I remind them about the smallpox. That we were able to get rid of smallpox just because of vaccine. So I think science works, vaccine works. Get the vaccine and go get it. That's it.
Yeah, there it is. Real clear, just go get the vaccine.
Yeah.
It's much better to have that vaccine and to be prepared than to come down with COVID-19. I can tell you how serious that was. Well, we want to thank our panel again. We want to thank our panel again for the candid conversations tonight.
But before we do let you go, let me ask Jennifer, because I know you proudly were holding up your COVID-19 kind of badge, the vaccine, to say, hey, I've done this. I know you're on a different spectrum here from the other three who are kind of on the front lines. You work in the HR spectrum. But for you, why was it so important to receive the vaccine as well? And why did you not have any fear about getting it?
Science. I trust science 100%. For me, working in the vaccine clinic here at Beacon Health in the northern part of the state, we wanted to be the leader and giving the most vaccines. And so for me, being able to look at a person coming in and saying, I've gotten it, you know, and just to be able to, again, reassure our frontline workers, you know, that might have had some hesitancy out of, hey, I've gotten it, I didn't have any side effects or this or that. It was important for me to show them that I was standing alongside them and I was supporting science and I wanted to bring an end to this pandemic.
And we thank you so much for all the efforts that you all have made here.
And let's continue to pray for all of the families dealing with loss and dealing with sickness as we continue to fight this pandemic.
Stay healthy and stay safe.